Good afternoon, everybody. This is Sue Grinnell from the Public Health Institute. Welcome. I know folks are just joining, but I just want to kind of get us going here. So welcome to this first in a series of 4 web discussions that we are hosting specifically for the CACHI accelerator sites, but others who are partners or possibly some of the Catalyst sites may be joining. These topics that we're presenting were identified based on the baseline assessment tool that the accelerator sites completed. For some of you, this information may be a repeat, it may be a reminder, and it also may be new or kind of maybe the way that it's presented, kind of have you thinking about your work in a different way. And this is all really in service to you as you're on your journey to become an ACH site. So I want to turn this over to Rebecca Garrow and Kylie Gallington from the Survey Research Group. Hopefully all of you that are accelerator sites have had contact with them. They are doing these structured group interviews. So they are part of the evaluation team. And just want to encourage you, excuse me, to keep your computers on mute or your phone if you're not talking. Sometimes there's background noise, but also to speak up. We really want this to be an engaging dialogue. You can use the chat box or you can just speak up. So with that, I'm going to turn it over to Kylie and Rebecca.
Good afternoon, everybody. Thank you, Sue, for that introduction. So as Sue said, this is the first in a series of 4 webinars that we're going to be delivering every Tuesday for the next 4 weeks. The first 3 are going to be just introduction to data. Today, we're going to be talking about identifying short-term, intermediate-term, and long-term indicators for measuring outcomes. Again, my name is Rebecca Garrow. I'm a program manager with the Public Health Institute's Survey Research Group. I'm joined by my colleague here. I'll let her introduce herself.
Yes, and I am Kylie Gallington. I'm a research associate with the Survey Research Group with Public Health Institute.
Okay. Here we go. Okay. So today we're going to be talking about a couple of discussion topics. So identifying short-term, intermediate-term, and long-term indicators for measuring the outcomes that hopefully your ACH has either already identified or is working to identify as a part of your program. Developing tools such as logic models to illustrate how your indicators are going to tie into your long-term goals. This can help with organization and especially with projects like the ACH, where we have multiple agencies and multiple people all collaborating together, having something like a logic model to illustrate sort of the path of how the project will go and be evaluated can be really helpful to make sure folks stay on task. Developing indicators for specific interventions. We're going to give examples of those as well as how to identify some common indicators that may be helpful for your program. Identifying data sources to measure indicators, and strategies, so sort of just some inspiration. All ACHs may not be here yet, but just strategies for sharing and visualizing your indicators. So using live stories or other websites, mapping things using geographic information systems or other way to sort of share the data you're collecting and highlight your program achievements. So as we said, we've talked to a lot of people who are going to be participating in this phone call. Kylie and I are evaluating the ACHs and working closely with the Catalyst sites to sort of see progress over these next few years. And something that Kylie and I have learned, we're almost done with all of these structured group interviews, is that our CACHI sites are really starting at different points. We have sites, this is their first at-bat. Our coalition is just getting together. Everybody's still kind of getting to know each other. We're still talking to partners. We also have a couple CACHI sites that have been working together for years. This is enhancement funding for them. They are on third base, ready to be waved home. So in light of just acknowledging that all the sites that may be participating today or that we've conducted structured group interviews with are starting at different points, this is a very short presentation. So those of you who are looking to come in on a Tuesday afternoon and listen to me speak for a full hour are going to be disappointed. But those of you that were hoping you would have a little bit of interaction and have space at the end of this for us to maybe talk through some specific program questions, that's really what we're hoping to accomplish at the end of this webinar, as well as future webinars that we're doing in this data series and in the core metrics webinar, which sort of rounds out the three. So today we're giving a very high level overview. We are not going to go into specific details for doing this stuff. If you need specific details, we can provide resources or set up a one-on-one technical assistance phone call with you. We are always available to you. This is myself and Kylie's contact information. I'll display it on the last slide at the end of this. But we're really hoping today at the end of this presentation to get to talk to you about your specific questions or projects and maybe kind of work through some indicator, outcome, or logic model questions you may have. Okay. Two really brief definitions we wanted to cover just to make sure we were all on the same page was an indicator. An indicator, simply put, is just data, statistics used to measure a health outcome. When we talk about logic models and theory of change, these are frameworks to visualize your program planning, and your evaluation of logic models will include inputs. So when we talk about inputs, activities, outputs, and outcomes, we're really just listing out things we need, things we will do as a part of this program. Your outputs will be the things we measure. Your outcomes are going to be the things your program will change. So if we're gathering all your inputs, conducting all of these activities, measuring these outputs, we should be able to identify some short-term, intermediate, and long-term outcomes. So the Healthy Smiles Initiative. If you're not familiar with this initiative, that's because this is a pretend program. So we didn't want to call any specific program out today. So for the Healthy Smiles Initiative, and we're just going to do this for demonstrative purposes, we want to reduce the prevalence of dental caries in Sacramento, California. That's what our pretend Kylie Rebecca ACH is going to do. Our program, we're going to develop a curriculum to train dental hygienists on proper tooth care, including brushing frequency to aged children and their parents. We want to conduct outreach sessions at schools and workplaces with both children and parents to encourage and teach healthy brushing behaviors. Let's look at what a logic model may look like for the Healthy Smiles Initiative. So a lot of information coming up on the slide all at once. I'm going to go over column by column. Inputs that we may have are ACH project staff. We also may have information or guidance from the American Dental Association.
On that webinar, but no, I'm good.
We may have dentists on board in our local Sacramento community who are going to participate in this project, dental hygienists, as well as the patients, so the children and their parents who are attending these clinics that we partnered with. Yeah. The activities that we may conduct as part of the Healthy Smiles Initiative include purchasing supplies, developing a curriculum, conducting some of these trainings, maybe some school. Sorry, can we ask that people put their phone on mute, please?
Yeah, please. I hear some laughing, which, yeah, if you could just put yourself on mute, that would be great.
And no worries, we totally get it. Brushing your teeth is a completely hysterical activity for most of us. I can barely stop from laughing as I brush each night. Okay, so we also may conduct some trainings for the dental hygienist. So activities is really just a list of things that the ACH program will actually do throughout the duration of the grant. Your outputs, these are the numbers. This is where we tally and count everything up. The number of toothbrushes distributed, the number of curriculums that are developed as a result of this program, how many hygienists were trained, the number of patients trained at schools, the number of students we reached at a school assembly, how many trainings we held with dental hygienists or with dentists. And all of these outputs are going to lead to being able to measure short-term, intermediate, and long-term outcomes. So a long-term outcome, we want to make sure we state too, these are usually things that you're not going to be able to measure as a part of this grant cycle. Unless you're lucky enough to get a 10-year funding cycle with some project, it's going to be really hard to measure long-term outcomes. That doesn't mean we don't still want to create them and measure them, but it may not be something that's feasibly measurable within a grant cycle. But short-term and potentially intermediate term outcomes are things that we will be able to measure. So short-term is just the number of people who report an increase in brushing or flossing. It could be changes in knowledge, attitudes, behaviors, improved dental hygiene behaviors. All of these things are going to lead to improved long-term health outcomes. So let's talk about the indicators that we may use as a part of the Healthy Smiles initiative. So our short-term indicators were an increase in the report of brushing and flossing teeth. I'm just going back, so with our outcomes, an increased reporting of brushing and flossing teeth. How would we measure that? These indicators would be the average number of times per day that you're brushing your teeth or that your child is brushing their teeth. Same thing with the flossing. That would be both short and intermediate. Long-term would be reduced dental decay. We would measure that with an incident rate. So the number per 100,000 in Sacramento County of dental caries and seeing how that changes over time. And if we could connect that to the efforts we're making with our program. Data sources for indicators. Well, before we move on, are there any questions or clarifications so far? Okay, good. Data sources for indicators. So ways for us to measure progress on our indicators can be done with secondary data or with primary data. The difference between these two is that primary data is something you or your research staff are going to collect, and it is specific to your program. So this may be patient surveys conducted by our Kylie Rebecca Sacramento ACH staff at the dental clinics, with the dental hygienist, with a select number of parents. So these are things that are specific to our program. Secondary data sources are data that are collected from larger, potentially usually more population-based surveys that were not collected specific to this program, but still could be used to measure progress towards outcomes. So the California Health Interview Survey from Sacramento County does capture things on whether people have dental insurance, their hygiene behaviors. We may be able to obtain dental records at dental offices through a data sharing agreement, which we'll talk about in a future webinar, with some of these offices in Sacramento that we've partnered with. So these are data sources that we can use for our indicators to measure progress towards our short, intermediate, and long-term outcomes. We want to give some specific examples of indicators. So we're going to talk about the Supplemental Nutrition Assistance Program Education Framework. This is actually a pretty neat tool, and there may be some folks on the line who have experience working in SNAP-Ed. They have developed an evaluation framework and interpretive guide. They have 51 indicators, and all SNAP-Ed programs across the country use these to evaluate their projects. In addition to the indicators, they also provide details, background, research, measurement instructions, and sample instruments that other SNAP-Ed sites have used to measure things. So let's take a quick look at the SNAP-Ed toolkit. Let's see, Kylie, can you please help me bring that up? Yes, thank you. Oh, the new share, thank you. Okay. Oops. There it is, right? Oh. We're bad researchers, we're not taking the survey right now. Okay, so two indicators that we want to talk about. An individual indicator we'll look at for the SNAP-Ed framework, as well as a, I think, sectors of influence one, yes, okay. So just in terms of an individual indicator, let's look at the dairy one. So this is an example from the SNAP-Ed toolkit in looking at talking about dairy consumption. So talking about the change in dairy product consumption and or adequacy of consumption over time from year to year for a low income population of a state. So it gives you an example of the indicator, background and context. I'm scrolling down what the outcome measures will be. So for this indicator, They're providing specific questions that you are, or specific measures that you can use to sort of measure progress towards your indicator over time. So this third one down right here, the number or percentage of SNAP-Ed eligible persons who switched from whole or 2% milk to fat-free or low-fat 1% white milk, with or without cereal. I just noticed that they put white milk, so no chocolate in that one. For adults and children, they give you what to measure. They talk about the population that it's been tested with, and then they also give you examples of survey tools that have used this variable before. So this is not an example of something that we would expect any ACH site to create. It's more just an example to show that there are indicators out there that have already been developed many times for several similar programs. When we were doing our structured group interviews, we could tell like, oh, these nationwide surveys or these programs have developed indicators, measurement tools, and have validated instruments for people to collect this data to measure progress towards outcomes. Another one we wanted to talk about, let's see, MT11, was the healthcare, clinical community linkages. We hear a lot about this with our ACH program. So this is a multi-sector framework component. The indicator description is community health initiatives that link healthcare systems with community groups to meet the nutrition, physical activity, or obesity prevention needs. This may be something that other ACHs find useful. It provides, again, the background and context. And again, what we see is really helpful are these outcome measures. So looking at this, MT11C, the number of healthcare centers that give families innovative prescriptions or vouchers for fruits and vegetables or physical activity, so the green prescription program. So again, just another resource and an example of this SNAP-Ed evaluation framework. But this is not exclusive to SNAP-Ed. There are several other frameworks that could be relied upon to help you measure outcomes for your ACH. Let's go back. I can do a new share. Let's go to the PowerPoint.
And if I could just add as well, part of the reason we wanted to share the SNAP-Ed evaluation framework with you all is we know ultimately the goal is to get to that portfolio of interventions. And so something to consider when you are developing indicators for measuring your work is trying to come up with common indicators that can be measured across those interventions. So rather than having specific indicators for this intervention and this intervention, the SNAP-Ed framework is a really great example of common indicators that can be used across various types of programs and interventions.
Thank you, Kylie. Okay, monitoring and sharing the data. So you've worked with your partners, you've identified your goals, your objectives, your indicators, you have a logic model, you've gone through your activities, you've counted your outputs, you're measuring your outcomes. Now we want to know all the amazing work you've done. So there are several ways to sort of monitor and share the data. I think we're all familiar with sort of the static ways, which are still very relevant, but the white paper, press releases, reports posted on websites, manuscripts that can be submitted to peer-reviewed journal articles, or just handouts and one-pagers that can be used not only to promote the work, but with funders and other partners. There are also dynamic things that you could set up to share with your data. So utilizing geographic information systems or interactive data visualization applications. These are available through SharePoint, and sometimes WordPress has additional added components you can use to display data, as well as live dashboards. We use live dashboards a lot to obtain data, but also using live stories and other applications to sort of monitor and share your data once you've collected it is something that's incredibly beneficial, not only in promoting your work to partners and funders, but in helping sort of identify what next steps for an ACH may be.
Okay, so we wanted to share just briefly an example of a live stories site that our staff developed. And this is an example of a live dashboard. So let me go ahead and bring it up. And this was for Monterey County for the core metrics. And Sue, I wanted to go ahead and give you an opportunity if you would like to introduce the core metrics or kind of give some background on that.
Sure, just briefly. So on February 13th, it's the last web discussion that would be held on the subject of data and metrics, and it will be on the core metrics. For each of the 9 sites, we are gathering the core metrics data, and you will have that probably either right before or right after we have that discussion. And we use live stories in both Fresno County and Monterey when we did this project. And so I just wanted to draw your attention to the fact that here's an example, of this website, and that, just reminding you about the core metrics. Also, just lastly, I've mentioned to you all on the last call, actually the last 2 calls, about the Health Data Ambassador opportunity that's coming up. So they are speaking to the fact that they may use live stories as the data visualization tool. I don't know that they've landed on that, and a lot of that work will really be helping those sites who will get selected, as well as, all of us, to learn how you can visualize data to be more meaningful for your community. So thank you.
Great, thank you, Sue, for that background. So really, what I would say first, the purpose of a live dashboard like this, one obviously is data visualization, and we'll kind of get into that. This is a really great way of showing visually in graphs, in maps, as well as sometimes in other media components that you can incorporate into the website, what the meaning behind your data ultimately is. It also provides you a really quick tool for sharing out and very broadly disseminating the findings that you have for your work. This website, I will note, was created in English and in Spanish, so you could click here to be taken to the Spanish version of this website. But this website link could be sent to anyone and shared very broadly. And then in addition, a live dashboard is really intended also as a dynamic monitoring tool for you. So as an example, the data within this website can be refreshed on regular intervals as the data gets updated, but also changes in the data can be tracked over time. So additional graphs can be created to show what the trends over time look like. And this just gives you a quick way of tracking the progress that is being made. So some websites like this are actually a bit more interactive. For example, you would be able to drill down and filter by subpopulations, and the entire page would just refresh. So for example, I could click on African American and it would just refresh the page to show only statistics for African American population. We don't have any of that to show you, but just to quickly show you, basically this website has been built to incorporate a combination of indicators and media content to tell a story and provide indicators for the core metrics for Monterey County. So I'll scroll down a little bit. Are there any questions from anyone on the call about core metrics or the live stories site?
And are any of you using live stories now that are on this web discussion? Okay.
Okay, cool. We also want to talk about a more static example. So that was more like a dynamic live one that could be constantly changing and updated with data. This is a project that Survey Research Group did in Kettleman City. This was a qualitative and quantitative data collection effort. It was a community canvas across an entire, oh, sorry, do we have a question? Who's that?
Trying to see, looks like there's something.
I'm answering it, yeah, yes. Thanks.
Okay, we're getting all this flashing on our screen. We're like, oh my gosh, okay. Thank you. Okay, sorry. So this was a community canvas where we went into Kettleman City and conducted bilingual interviews. We approached every single house in the city at least 2 times to speak to adults over the age of 18 on what they were most concerned about living in Kettleman City. and also some of the best things or sort of community strengths that they wanted to share regarding living in Kettleman City. So we came out with 2 reports. One was a report that was part of our contractual requirements. It was for our funders and maybe more towards professional research audiences. This is very typical to come out with a report like this. I'm sure everyone's familiar. It has loads of appendices and all of our tables and our entire methods section. And then we also came out with a final report that was for the community. So after visiting the community, relying on them to share their stories, their information, and just doing data collection with the community, we always want to make sure we return that data back to the community. And we didn't want to do it in a final white report. So we're going to look at both of those. Pull it up on my screen. Mm-hmm. Okay. So not that, but this. Okay. So this is our white report. I'm not going to go through this. I'm going to do a brief, well, you know, the table of contents is really great. It just shows you all of our sections. We go through the methods. We have all of our appendices. I'm just scrolling through. There's nothing, you know, yeah, okay, here we go. So we kind of give like a literature review, large investigative report summary. We talk about cancer incidents. We go into our methods. So this is available on our website. If you need some really exciting reading that lasts about 75 pages, maybe a little bit of a nighttime soothing relaxation, this report is on our website. I want to focus on the Kettleman City Community Report. So we developed, oh, is it not going to display? Oh, trying to get this to display. Oh, that's too bad. Is it because I'm in Internet Explorer? Let me open this in Chrome. Oops. Sorry. Oh yeah, I guess I could.
Here, why don't you talk about it and I'll
Thank you.
try to download it.
Go ahead. Yeah, or save it to the desktop. Sorry, folks, 1 second.
Oh, it's saved as a,
I need to open up Chrome.
yeah.
There we go. Okay. Yes.
No, do the Chrome.
Okay. Sue, can you please confirm that you can see this blue document?
I can see it.
Great.
In Spanish, yes.
Okay. Yes. So this is an example of a report where we took our white paper report. I'm going to scroll through it a little bit and gave results back to the community. So this report is done in Spanish because we'll get to that in a minute. So first page is why we came to Kettleman City, and we described the hazardous waste facility was there. They were required to provide funding by Kings County. So our data collectors came out, signed a contract with ChemWaste. We came out, we talked to folks, we used our iPad, we visited every city one time and talked to people about their concerns on living with Kettleman City. 99% of the people we talked to were Hispanic or Latino. 3 out of every 4 was female. 75% had less than an 8th grade education. 80% of our interviews were conducted in Spanish. And so we knew when delivering these results, we really had to make sure not only that we provided these in the language that we conducted the interviews in, whereas our white paper was done solely in English, but because of the educational level, we knew that this had to be a really visual report. So throughout this report, you're going to see that we used a lot of pictures. We used a lot of large percentage signs, so we're able to communicate things. One thing people said they were really worried about, I'm over here on the right, was the streetlights. The contaminated water up on the top right, over the left center here, immigration issues were of great concern to people. 2 out of 3 people felt that the condition was getting worse, not better. The most important things to folks were the street conditions, air pollution, water quality, pesticides, loose dogs, and street lights. This was really important to us because the reason that this grant was disseminated and funded was based on 2009 data that had to do with cancer concerns and miscarriages. So kind of being able to deliver back to the community as well as to our funders that those things were no longer the top priority concerns. Let's see, I'm gonna scroll down a little bit. We asked people what their ideas were. And we also asked what we felt was important. What do you like best about living in Kettleman City? People felt it was calm. It was a small town vibe. There were lots of opportunities for employment, and it was an affordable city. So that's just an example. We won't go too much into it. This is on our website too, but of sort of creating a quote unquote final report. We also learned through doing these surveys that the majority of the people who participated in our study did not like to receive their information from websites. So we actually printed these out and mailed them to all the participants. It is available on our website. Okay, share. Okay. Oh. Okay, so in summary, how is all of this relevant? Why is it important to create logic models, identify your indicators, measure outcomes, and think about the products that are going to result and that you're going to present to the community, to your stakeholders, and to your funders? Being able to describe your project in a variety of different ways can be very valuable. When you're dealing with funders and research, a lot of times it's numbers, it's tables, it's background information that's really going to speak to folks. When you're describing this project maybe to partners, you may want to think about live story sites or other methods that are innovative in sharing data and communicating the goals and the progress and the successes of your ACH. Monitoring. Tracking indicators consistently over time can help you track progress towards your ACH goals and outcomes. Developing logic models can also help guide and provide a structure to your write-ups, your one-pagers, your indicators, any causal maps or graphics. This can kind of help keep folks on task and driving towards the same goal. Logic models can also help capture multiple interventions and display synergy across projects. This may be valuable because we know these ACHs are made up of several collaboratives, so being able to track progress towards one large overarching goal from a variety of different stakeholders, projects, and processes can be valuable. It can also help you display return on investment. So if you can show reductions in costs, increases in revenue because of referrals, or anything else, this can really be beneficial to your project. We are now going to stop speaking and talking about examples, and we are hoping to hear from you. So we would like to invite participants to unmute their phones. If you have specific questions about indicators, about measuring, about logic models, we would like to take the rest of the webinar opportunity to discuss those. Likewise, if anybody has any successes, if anybody has really has examples that sort of enhance this presentation, this is not the end all be all. We'd like to hear from you. We think it would be really valuable if there are any ACH sites out there who can share some success stories in measuring indicators or working across these synergistic efforts. We would like to hear from you.
Yeah, thanks, Rebecca and Kylie. And just, I would encourage you to ask questions, or if you'd rather use the chat box, you're more than welcome to do that as well.
Hi, this is Joe Prado with Fresno County Public Health. You know, in your background, when I see the logic model, to me that is a great planning tool, and you're really giving it some structure and how you're going to go about in choosing your metric and going through that piece. What's been your experience when you're trying to go out and getting funding outside of the public health world, and really that logic model and going through those steps? Is that something to where you see other funders kind of, okay, can you just get to the point and tell me what your metric is, and do kind of tell me your story in a lot smaller framework as opposed walking them through a logic model?
I'm happy to respond to that, but Sue, I thought maybe you would like to provide insight on that first.
Sure. Hi, Joe. And I know, Joe,
Hi.
you have a great tool as well. And I think we have the link to it under the Fresno ACH site on the WordPress site. So thanks so much for joining.
Yeah, great. Thank you.
I think, you know, I have been in public health for a very long time, for better or for worse. And I think, you know, for a long time, it feels like the logic model has been kind of I'm going to call it the Bible, so to speak, of public health. And what I'm seeing, I think more so is I think it's still being used, and I think it's a very helpful tool. And a lot of the funders, probably government funders, are asking for things like a logic model. I see, though, a movement towards a theory of change, where maybe you're not necessarily, so kind of the elements on a theory of change, and certainly can share those with you, are maybe not as specific, because we're operating in more of an emergent kind of complex world than when logic models were originated. And I think, you know, just thinking about some of the funders, I think, you know, I was talking to somebody the other day, and they said something that I thought was really interesting. And they said, you know, the funding world is kind of moving and transitioning from the baby boomers into more millennials. And what they want to know is, what are they getting for what they're paying for? So they really want to see kind of the impact. You know, I think the impact of what you're doing, and impact might be outcomes, but it may or may not necessarily always be some of the traditional kinds of things, you know, that we thought about. And so thinking about what's the social impact, the human impact, some of these other things that maybe we're not as comfortable gathering some of that information, or we don't have a data source per se, is kind of this emerging field of what I'm sensing out there. So I don't know if that makes sense, or it's helpful, or not.
No, it does. It's that whole impact side of it. It's a very hard bridge to make with public health and the impact out in our community, because we really don't have all those different variables, those data sets readily accessible. So yeah, and I appreciate your comments on the funding sources, because I think as we look to making substantial change in our community, we need to look outside the normal public health funding for it, and it has to come from other type of sources. And so I was just curious about, anytime you build a tool set like this, you want it to be used, and you're building this tool set so it can tap into a lot of these funding requirements at the same time, right? And so I was just very curious to kind of get some feedback on that as we move into what our metrics look like here at Fresno FCHIP. I really wanted to think about that as we move forward and start committing to some of these metrics.
There's just one last thing. There's theory of changes, just, and again, you know, for anybody that's not familiar with those, like I have one for the lab, you know, for the innovation lab, that I'm more than happy to share. And it might be, for some of you, a bit different. Because it's kind of basically saying, this is the operating context of which we're living in. Like, you know, here's all of these different things. And we believe if we do X and Y, we're going to get to Z, right? So it's kind of putting it out there, the theory, because I think oftentimes that's what I hear funders is they want to know, well, how are you going to do this? And, you know, some of those, and you may not, you know, have all of those indicators. And so I think, you know, I'm really hopeful that, you know, you all have interest, right, in exploring, because there's a lot of ways that we could look at gathering, you know, different indicators. There's a company that some of you might be familiar with, and it's called Insight Information. And the guy who runs it, his name is Bill Barberg, and he's in Missouri. And he does some interesting things where he's taking strategy maps. And so that's a different kind of way to lay out, you know, your work. But he actually has created a visual way that, like, say, an ACH or a collaborative. So if you're saying, here's your collective shared vision, so that's one of the ACH elements, right? Here's your vision, and maybe you have 4 or 5 or 3 strategy areas that you all agree might be things that you're going to work on. And under that are a variety of different activities. And the way that it's programmed is that you can actually say, well, the Fresno Health Department is going to work on this one, and you're going to collect this data. Here's the metric for that. So for each of the activity, you can actually show different ways that you can collect, you know, so it's live, right? So you know, kind of that notion. So that's another tool. If any of you are interested, I know Bill, you know, we could certainly have him give a presentation. I know Monterey is using that. I don't know if any of you have looked at that tool, or if you're familiar with it, or even interested.
Yeah, thanks for that good question. I guess I love all the insight you provided, Sue. And one thing I would add for us, you know, here at the Public Health Institute's Survey Research Group, we're very into the nuts and bolts and the details of it. Just personally, one thing that I have found beneficial in using logic models or causal mapping, or just any sort of tool, is that it helps demonstrate what we did and what we achieved at the end of a project. So it sort of makes you think about the things you will count as a result of your activity, which can help show your funder what you achieved, or additional funders what you did. I think for us, sometimes what we'll see in public health programs is that people do amazing, I mean, truly life-changing work for communities of high need. But without the evaluation component, or maybe just sort of like a structure to sort of show the connection between your activities and the outcomes that people had or experienced, it's hard to show to somebody who maybe works in Sacramento or in DC and is sort of reviewing a report or sort of reviewing a grant application or something. It's like, well, what happened? You know, you did all this great work. What was the result? So sort of a plug for evaluation, I guess. Other questions on the phone, or are there other tools, resources, or success stories that folks would like to share that other people on the call can benefit from?
So this is Martin from Humboldt. Seems like there's tension between choosing good outcome indicators and being able to show progress. An awful lot of what interests people is going to take quite some time. And so there must be some sort of way of keeping people involved and interested and encouraged.
Yes. Can you provide maybe a specific example that you've experienced that demonstrates that?
Well, I don't know that I have an example. I mean, what we're working on is substance use disorder, and some of our top level indicators have been, I don't know, static for quite some time. I don't anticipate them changing much over the next year or so.
And maybe they shouldn't, right? I mean,
Yeah, so Rebecca, I think this was something I'd sent you in an email, and you didn't cover it on this webinar, like just in terms of the different types of measurements, right? So there's process measures, there's outcome measures. I think, Martin, what I'm thinking of as you're speaking, I mean, long term, as you're working with your ACH, and I'm just going to throw out for instance, maybe you will eventually get to the place where you're going to say, we're going to do X, you're going to reduce something by a certain percentage in 5 years. We'll just say 5 years. And I think that's where kind of thinking about your role, right, as the ACH in terms of the processes or structures that need to be in place to help you to get to those things, as well as maybe there are some short-term indicators that might more directly relate to substance abuse, and then looking at short-term, intermediate, and long-term. So I think sometimes we forget that there are these kind of processy things, the effectiveness of an ACH, right, or different partnerships that are happening that help us to get to that, and that's kind of part of the equation as well. If that makes sense. So Rebecca or Kylie, I don't know if you have anything else to add to that piece.
Sure. Thank you. I think I better understand now. So yes, definitely process and outcome evaluations. And again, I think we'll go back and just emphasize a lot of long-term outcomes, which are probably the likely high-need outcomes of these ACH programs. So like a reduction in substance abuse behaviors are not things that are going to be feasibly measured within this current grant cycle and within many current grant cycles. But a lot of the activities and the process evaluation measures and indicators should be leading towards that. And it sounds like there are. We may not be able to measure it, but there's a lot of other, I would say, Kylie, you can comment on this, indicators that we can use. I mean, I'm thinking of like the trans theoretical model, like, stages of change. So it's like, maybe if we can show like, so we'll use smoking as an example. So maybe the number of people who were smoking, we're not able to measure a decrease within a 2-year cycle, but we are able to measure knowledge attitude changes towards smoking. So maybe we have an increased number of smokers who say, yes, I am now considering quitting within the next 6 months. And maybe that number increased from our baseline. Does that make sense?
Sure.
Cool.
Yeah, and I would just add, this is where having a clear logic model can be really helpful for explaining how short-term and more intermediate-term indicators are believed to feed into those long-term indicators. So the example of logic model that we showed was just very basic, 4 columns. Sometimes you'll see logic models set up a little bit differently where you have specific activities and specific outputs that are leading to specific indicators. And it looks a little bit more like a causal map in some ways. And that can be helpful for demonstrating, based on a theory of change, how you see the activities actually leading to outcomes ultimately. If you have specific or intermediate term indicators that are feeding into the more long-term outcomes and ultimately the goals of your project, then you can make a case for measuring those short and intermediate term indicators as a proxy for promising work that we expect to measure in the future.
Good.
Yeah. Other questions or just other stories that folks would like to share with some of the other sites on the line? While folks mull that over, I do want to say that next week we'll be delivering another webinar really similar in this format. I think Stu sent the invite out already, but it's going to be public use data sources. If you're able, please start thinking about specific questions or examples you may want demonstrated as a part of this webinar. If you email us ahead of time, we can include maybe some success stories that you've had. If you have any questions ahead of time, you can email us those ahead of time, and we can make sure to address them in the webinar. So things on public use data sources next week.
Mm-hmm. Great.
But in terms of this webinar, another call, any stories that folks want to share, any questions that you may have?
Well, it seems like we're good, guys.
Cool.
But if you have questions, sometimes, after you're thinking about something, please, know that, Rebecca and Kylie are here to assist. And certainly if you want to talk through some of these things, because it's a lot, as you're trying to think about what you're trying to do. So that offer is there.
And I will say too, that as part of this, Kylie and I will sort of be the gatekeepers to this, but PHI's survey research group does have a variety of different research scientists from many different backgrounds and skill sets. So there's a good chance that if you have a specific indicator you're wanting to measure, a specific program objective, if one of us has not participated in a public health activity that measures that specifically, we likely have a colleague who has. So we can definitely connect you with the network of researchers that we work with here.
Great. Great.
Thank you so much, everybody, for participating, and thank you for your good questions.